What if I told you that getting out of a nursing home might be harder than breaking out of prison? That even when you're medically cleared to leave, they'll fight you every step of the way. My name is Robert. I'm 78 years old, and 18 months ago I did something my family thought was impossible, my doctor said was dangerous, and the nursing home claimed was irresponsible. I escaped, not in the middle of the night with a rope made of bed sheets. I legally, systematically, and successfully transitioned myself out of institutional care and back into independent living. And today, I'm going to tell you exactly how I did it. Because the nursing home industry has a dirty little secret they don't want you to know. Once they get you, they do everything in their power to keep you. Not because you need to stay, but because they need you to stay. Your monthly payments, your insurance reimbursements, your bed occupancy, that's their business model. But here's what they don't tell you. In most cases, if you're determined enough and smart enough about the system, you can get out. If you or someone you love is trapped in institutional care that you don't actually need, or if you want to make sure you never get trapped in the first place, what I'm about to share could literally save your life. Hit that like button if you want to learn the exit strategies they never tell you about, and subscribe because I'm going to expose every trick they use to keep you dependent when you could be independent. Chapter 1. The Admission Trap. How they make leaving impossible from day one. Let me show you the admission paperwork I signed 18 months ago. 37 pages of legal documents that I was expected to review and sign while I was still recovering from surgery, on pain medication, and scared about my future. Page 23, paragraph 4. Resident acknowledges that leaving against medical advice may result in serious injury or death and releases facility from all liability. Page 31, section 7. Family members designated as emergency contacts will be notified of any attempt to discharge against facility recommendations. Do you see what they did there? They made leaving seem so dangerous and irresponsible that even thinking about it feels like a betrayal of your own safety and your family's peace of mind. I came here for short-term rehabilitation after hip surgery. The discharge planner at the hospital said, just until you're steady on your feet again. Probably 6 to 8 weeks. That was 18 months ago. Here's how they trap you from the very first day. They don't create a plan to get you out. They create a plan to keep you in. Instead of aggressive rehabilitation focused on independence, they provide maintenance care designed to keep you stable, but not necessarily improving. Instead of preparing you to live independently, they adapt you to live dependently. My first red flag should have been the initial care conference. My daughter, the social worker, the nurse, the physical therapist, and me all discussing my needs. But nobody discussed my goals. Nobody asked what I wanted my life to look like in 6 months. Nobody talked about what independence would require or how we'd measure progress toward that independence. Instead, they talked about keeping me safe and comfortable and well cared for. Those are maintenance goals, not recovery goals. And if your goals are maintenance, that's exactly what you'll get. Forever. Comment below. If you were in a nursing home, what would your independence goals be? Because I guarantee nobody's going to ask you unless you demand that conversation. The most insidious part of the admission process is how they gradually shift responsibility for your life decisions away from you and toward the care team. It starts with small things. We'll manage your medications so you don't have to worry about them. We'll plan your meals so you get proper nutrition. We'll schedule your activities so you stay engaged. Sounds helpful, right? But what they're really doing is taking away the daily practice of managing your own life. And once you stop practicing independence, Independence becomes impossible. 6 weeks into my stay, I asked about discharge planning. "Oh, we want to make sure you're really ready," they said. "Let's see how you do for a few more weeks." Those few more weeks turned into months. And every time I brought up leaving, they had a new concern, a new reason why it wasn't quite time yet, a new risk they'd discovered. That's when I realized they weren't preparing me to leave. They were preparing me to stay. If you're starting to see how nursing homes profit from keeping people longer than necessary, smash that like button and get ready for my next revelation. How they use your own family against you to prevent discharge. Chapter 2. The Family Manipulation Machine. How they turn your loved ones into prison guards. This is the phone call that almost broke me. My own son saying, "Dad, I think you should stay a little longer. The staff is worried about you living alone." Let me tell you how nursing homes weaponize your family's love against your independence. It starts with the family conference, which sounds collaborative but is actually a carefully orchestrated manipulation session designed to make your family terrified of supporting your discharge. Picture this. Professional medical staff in a conference room presenting a list of everything that could go wrong if I went home. Falls, medication errors, social isolation, dietary problems, medical emergencies with no one around to help. Then they turn to my son and daughter and ask, "How would you feel if something happened to your father because we discharged him too early?" What kind of answer can a loving child give to that question? Of course they're going to err on the side of caution. Of course they're going to say, "Maybe we should wait a little longer." The staff nods sympathetically. "We understand this is difficult. We just want what's safest for Dad." But here's what they don't present in that meeting. Statistics showing that people often do better at home with appropriate support. Evidence that institutional living itself creates risks. Data showing that people who maintain independence longer have better outcomes. They present only the risks of leaving, never the risks of staying. They also don't mention that I was asking to leave, that I felt ready to manage at home with support, that staying was making me depressed and anxious. My perspective, the perspective of the person actually living this experience, was treated as less valid than their professional assessment of what was best for me. The most manipulative part was how they positioned my desire to leave as selfishness. "We know your father wants to go home, but sometimes what we want isn't what we need." They made my family feel like they'd be enabling dangerous behavior by supporting my independence, like loving parents refusing to give car keys to a reckless teenager. Except I'm not a teenager. I'm a 78-year-old man who successfully managed his own life for 7 decades before a temporary surgery recovery landed me here. Comment below. Have you ever had medical professionals make you feel guilty for wanting to support a family member's choices? Because this happens constantly in institutional care. The staff also feeds family members carefully selected information designed to increase their anxiety about discharge. "Your father seemed a little unsteady yesterday. He forgot to take his afternoon medication. We found him trying to get something from a high shelf. He could have fallen. Never mind that I've been a little unsteady sometimes my whole adult life, that I forgot medications occasionally even when I lived independently, that I've been reaching high shelves for 70 years without disaster." They medicalize normal human imperfection and present it as evidence of dangerous incapacity. Meanwhile, they don't tell families about the depression that comes from lost autonomy, the cognitive decline that results from unstimulating environments, the physical weakness that develops from lack of real challenge and purpose. They turn my family into unwitting collaborators in my imprisonment. My children genuinely believed they were protecting me by supporting the facility's recommendations to extend my stay. But they were actually protecting the facility's revenue stream while enabling my continued decline into learned helplessness. The breakthrough came when I started making my phone calls to family without staff present. When I could honestly tell my kids how the environment was affecting me emotionally and mentally, not just physically. When they realized I wasn't just being stubborn about wanting to go home, I was fighting for my psychological survival. If you're seeing how nursing homes manipulate families into becoming obstacles to discharge, hit that subscribe button, because next I'm going to reveal the specific tactics I used to build my escape plan. Chapter 3. Building my escape plan. The step-by-step strategy that set me free. This is my discharge planning notebook. 73 pages of research, documentation, and strategic planning that I compiled in secret because I knew the facility wouldn't help me leave voluntarily. If you want to get out of institutional care, you need to understand something crucial. You are fighting a system designed to keep you. That means you need a system designed to free you. Here's exactly how I built my escape plan. Step 1. Documentation. I started keeping detailed records of everything: my daily capabilities, my medication management, my mobility, my cognitive function, not what staff observed, but what I actually experienced. I documented every time I successfully managed something independently. Every day I took my medications correctly. Every problem I solved on my own. Every task I completed without assistance. Why? Because discharge decisions are supposedly based on functional capacity. If I could prove I was functioning better than their assessments indicated, I had leverage. I also documented every negative effect of institutional living: sleep disruption from noise, appetite loss from unappetizing food, mood changes from lack of privacy, cognitive sluggishness from understimulation. Step 2. Outside medical opinions. The facility's doctors had a vested interest in keeping me there, so I arranged for consultations with my previous primary care physician and an independent geriatrician. I asked them specific questions. What are my actual medical needs? What level of support do I genuinely require? Are there medical reasons I cannot live independently with appropriate services? Both doctors agreed that my medical needs could be managed at home with visiting nurses, medication management systems, and regular checkups. Neither saw institutional care as medically necessary. Step 3. Home safety assessment. I hired an occupational therapist to evaluate my house and recommend modifications for safe, independent living. Grab bars, better lighting, medical alert system, removal of trip hazards. This cost me $400 out of pocket, but it gave me professional documentation that my home could be made appropriately safe for my current functional level. Step 4. Support system development. I researched and contacted every available community service: meal delivery, transportation, housekeeping, home health aides, adult day programs. I created a detailed plan showing exactly how my daily needs would be met at home, complete with backup options and emergency protocols. Step 5. Legal consultation. I spoke with an elder law attorney about my rights regarding discharge against facility recommendations. I learned that I could not be held against my will unless I was declared mentally incompetent. The attorney also helped me understand Medicare and insurance implications of self-directed discharge. Comment below which of these steps surprises you the most, because most people don't realize how much work it takes to escape institutional care. Step 6. Family education. I shared my research with my children, not as a demand, but as information. I showed them the medical opinions, the safety assessments, the support plans. Most importantly, I helped them understand the difference between reasonable safety precautions and excessive risk aversion. Yes, living independently involves some risk, But so does institutional living, just different risks. Step 7. Financial analysis. I calculated the cost of institutional care versus the cost of independent living with support services. The savings were dramatic, almost $3,000 per month. That money could fund a lot of support services and safety modifications while still leaving me better off financially. Step 8. Trial period proposal. Instead of demanding immediate permanent discharge, I proposed a trial period, 30 days at home with daily check-ins, followed by evaluation of how well the plan was working. This gave my family and the facility a way to support the plan without feeling like they were making an irreversible decision. The key to all of this was patience and strategy. I didn't demand to leave immediately. I built an undeniable case that I could succeed at home, addressed every reasonable concern, and made it harder for them to say no than to say yes. If you're wondering how I actually executed this plan and overcame the final obstacles, smash that like button and subscribe, because my next chapter reveals the confrontation that finally set me free. Chapter 4. The Great Confrontation. How I finally forced my freedom. March 15th, 2024. The day I walked into the administrator's office with my 73-page discharge plan and said, "I'm ready to discuss my transition home." What happened next was the most intense negotiation of my life. The administrator looked through my documentation for about 10 minutes, then looked up and said, "Mr. Johnson, we're concerned that you're not thinking clearly about the risks involved here." That was their first mistake, questioning my mental competency instead of addressing my evidence. "Actually," I said, sliding a letter across the desk, "here's a cognitive assessment from an independent neuropsychologist showing I'm fully competent to make my own healthcare decisions. Would you like to question their professional judgment?" I watched their expression change. They realized I wasn't just another frustrated resident making emotional demands. I had done my homework. "Well, yes, but your physical therapy assessments show..." "Show what exactly?" I interrupted, pulling out another folder. "Show that I can walk 200 feet independently, that I can climb stairs safely, that I can transfer from bed to chair without assistance? Because that's what your assessments actually say." They started flipping through my documentation more carefully. "Mr. Johnson, what about medication management? You've had some confusion with..." "One missed afternoon pill in 18 months. One. And I've been managing my medications independently for the past 6 weeks as part of your discharge preparation program. 0 errors." The social worker jumped in. "But who will check on you? What if you fall? What if there's an emergency?" I pulled out my support services documentation. Medical alert system monitored 24/7. Daily check-in calls from visiting nurse service. Meals on wheels 4 days a week. Transportation service for medical appointments. Weekly housekeeping. My neighbor has a key and contact information for emergencies. "What about your family? Are they prepared to..." "My family supports my decision. Here are letters from both my children acknowledging they've reviewed my discharge plan and agree it's comprehensive and reasonable." Getting those letters was crucial. I had spent weeks educating my kids, showing them my research, helping them understand that staying wasn't necessarily safer, just different kinds of risks. The administrator was running out of objections. "Mr. Johnson, I'm going to need to discuss this with our medical director." "Of course, and while you're doing that, I'd like you to review this." I handed over one more document, a letter from my attorney outlining my legal right to discharge myself and the facility's limited ability to prevent it without a competency hearing. "I'm not threatening legal action," I said calmly. "I'm just making sure we all understand what the law says about patient autonomy and self-determination. The room got very quiet. 3 days later, I got the call. "Mr. Johnson, we'd like to schedule a discharge planning meeting to discuss your transition home." Just like that, the tone changed completely. Suddenly, staff who had been discouraging my discharge were actively helping plan it. The same people who had been pointing out risks were now brainstorming solutions. Why? Because I had made it clear that I was leaving one way or another. Their choice was whether to help make it successful or risk liability if something went wrong after they'd obstructed my reasonable discharge plan. Comment below, have you ever had to fight this hard for the right to make your own decisions? Because this is what patient advocacy sometimes looks like in practice. The actual discharge took 2 more weeks to coordinate, but it was a completely different process once they accepted that it was happening. They arranged transitional physical therapy. They coordinated with my home care services. They provided detailed medical summaries to my community physicians. They even helped me practice using my home medical alert system. The day I walked out those doors with my belongings was one of the most triumphant moments of my life, not because I was escaping something terrible, but because I had reclaimed my right to make my own choices about my own life. But the real test wasn't leaving. It was proving I could succeed at home. And that's what I'm going to tell you about next. If you're amazed that fighting for your own independence requires this much strategy and documentation, hit that subscribe button because my next chapter will shock you. It's about how much better my health got after leaving institutional care. Chapter 5. Life After Escape. Why I'm healthier now than I was in care.
These are my medical test results from my last month in the nursing home versus my results 6 months after returning home. The difference is going to shock you.
Blood pressure. 145/90 in the facility, 125/80 at home. Weight. Lost 12 pounds of muscle mass in facility, gained back 8 pounds of healthy weight at home. Sleep quality, 4 to 5 hours of interrupted sleep in facility, 7 to 8 hours of restful sleep at home. Medication compliance, 94% in facility with staff management, 99% at home with my own systems. Depression screening, moderate depression in facility, minimal depression at home. How is it possible that I'm healthier living dangerously at home than I was living safely in professional care? Because institutional care creates its own health problems that nobody talks about. Sleep disruption from noise, lights, and roommate disturbances. Appetite loss from unappetizing institutional food served at inconvenient times. Muscle weakness from lack of real physical challenge. Social isolation despite being surrounded by people. Loss of purpose and autonomy leading to depression. At home, I sleep in my own bed, in my own quiet room for as long as my body needs. I eat food I actually enjoy when I'm actually hungry. I walk to the mailbox, tend my small garden, prepare my own meals, real functional activities that maintain strength and coordination. Most importantly, I have reasons to get up every morning, goals that matter to me. I volunteer at the Literacy Center twice a week, something I couldn't do from the nursing home. I'm helping my neighbor restore a vintage car. I'm learning to use a smartphone so I can video chat with my grandchildren. These aren't just pleasant activities. They're cognitively stimulating, physically engaging, socially connected experiences that research shows are crucial for healthy aging. Comment below. What activities in your life require you to problem solve, learn new things, or help other people? Because those are exactly the things institutional care eliminates. The visiting nurse who checks on me twice a week is amazed by my progress. "You're like a different person than when you were discharged," she told me. "More alert, more engaged, more confident." Of course I am. I'm using my brain to solve real problems again instead of having every problem solved for me. I'm making meaningful choices about my daily life instead of following institutional schedules. I'm living like a human being instead of being managed like a patient. Don't get me wrong, independent living isn't risk-free. I've had some close calls. I had a dizzy spell in the kitchen and grabbed the counter to steady myself. I forgot to charge my medical alert device one night. I had a minor medication mix-up that required a call to my pharmacist. But you know what? I handled all of these situations successfully. They were learning experiences that helped me develop better systems, not catastrophes that proved I couldn't manage independently. The nursing home would have used every one of these incidents as evidence that I wasn't ready for discharge. At home, they became proof that I could handle problems and adapt my systems accordingly. My children were nervous for the first month, calling daily to check on me. Now they call because they want to talk, not because they're worried about my safety. My son told me last week, "Dad, you sound like yourself again." In the nursing home, you were becoming someone different, more dependent, less confident, less engaged with the world. That's the hidden cost of institutional care that nobody calculates, the loss of self.
The financial benefits have been dramatic, too. My nursing home was costing $4,800 per month. My current support services cost about $1,200 per month. Medical alert system, weekly housekeeping, meals on wheels 4 days a week, transportation service, and visiting nurse.
I'm saving $3,600 per month while living in my own space, maintaining my autonomy, and actually improving my health outcomes. If you're starting to question everything you've been told about the safety and necessity of institutional care for older adults, smash that like button, because my final chapter is going to give you the roadmap to avoid this trap entirely. Chapter 6. Your Prevention Playbook. How to Never Get Trapped in the First Place. This is the conversation I wish I'd had with my family before my surgery. Before the hospital discharge planner started talking about short-term rehabilitation, before I found myself signing admission papers while medicated and scared. If you're watching this video, you still have time to have this conversation. Don't waste that opportunity. Here's your prevention playbook, the strategies that will keep you from ever getting trapped in institutional care you don't actually need. Strategy number 1. Establish clear criteria for institutional care before you need it. Sit down with your family and define exactly what circumstances would genuinely require nursing home placement. Not vague fears about what if something happens, but specific functional losses or safety incidents. For example, I would consider nursing home placement if I have 3 or more falls in 6 months, if I develop moderate to severe dementia, if I require assistance with 3 or more activities of daily living, or if I have a medical condition requiring 24-hour skilled nursing care. Having these criteria in writing prevents emotional, fear-based decisions made during medical crises. Strategy number 2, create your independence maintenance plan now. Don't wait until you need help to figure out how you'll get help. Research community services, identify potential home modifications, establish relationships with geriatric care managers, interview home health agencies. Have a specific plan for how you'll maintain independence with increasing support rather than defaulting to institutional care. Strategy number 3. Build your advocacy team. Identify family members or friends who understand your values about independence and will advocate for your choices even when they're worried about you. Consider hiring a geriatric care manager, a professional who specializes in helping older adults remain independent safely. They know resources most families never discover. Strategy number 4, understand your legal rights. You cannot be forced into institutional care unless you're declared mentally incompetent through a formal legal process. You cannot be held in a nursing home against your will if you're competent to make your own decisions. You have the right to refuse recommended placements, to discharge yourself against medical advice, and to make choices others consider risky. Strategy number 5. Control the narrative during medical crises. Hospital discharge planners have quotas to meet and limited time to explore options. They default to institutional placement because it's easier than coordinating complex home care. Have your support team ready to speak up for alternatives. Be prepared to delay discharge planning until you can think clearly and explore all options. Comment below, which of these strategies do you most need to implement for yourself or your family? Because the time to plan is before the crisis hits. Strategy number 6. Maintain your physical and cognitive fitness aggressively. The stronger and more capable you are, the harder it becomes for others to justify taking away your choices. Stay physically active, socially engaged, and mentally challenged. Keep learning new skills, maintaining friendships, and contributing to your community. Independence isn't just maintained, it's earned every day through the choices you make about how actively you engage with life. Strategy number 7. Control your own narrative about aging. Don't let others define what's appropriate for your age. Don't accept that increased safety always justifies decreased independence. Be vocal about your values, your goals, and your willingness to accept reasonable risks in exchange for autonomy. Strategy number 8. Plan your finances for independence, not dependence. Instead of saving money to pay for institutional care, invest in home modifications, support services, and technology that will help you age in place. Long-term care insurance that covers home care, not just nursing home care. Home equity that can fund in-home services rather than institutional fees. Strategy number 9. Document everything. Keep records of your functional abilities, your successful problem-solving, your medication management, your social connections. This documentation becomes crucial if anyone questions your capacity for independent living. Strategy number 10. Stay connected to the outside world. Maintain relationships, activities, and roles that exist beyond your family circle. The more engaged you are with community life, the harder it becomes to justify isolating you in institutional care. Here's what I want you to understand. Nursing home placement is almost never inevitable. It's usually a failure of imagination, resources, or advocacy. With proper planning, adequate support services, reasonable safety modifications, and family commitment to creative problem-solving, most people can age successfully in their own homes. But it requires fighting for that option before crisis hits, not after you're already trapped in a system designed to keep you. My escape was possible but difficult because I had to fight the system after I was already caught in it. Your prevention will be easier because you can build the systems before you need them. Don't let fear, convenience, or lack of information steal your independence prematurely. Don't let institutional care become your default option when it should be your last resort. Fight for the right to age on your own terms, in your own space, making your own choices about your own life. Because once you lose that fight, getting it back, and as I discovered, is the hardest battle you'll ever face. But it's a battle you can win if you're prepared, determined, and strategic about your approach. If this story opened your eyes to the possibility that nursing home placement isn't inevitable, that you can fight back, that you can escape, that you can prevent this from happening in the first place, I need you to take action right now. First, smash that like button. This video needs to reach every family that's being pressured into institutional care they don't actually need. The nursing home industry spends millions convincing families that their facilities are the only safe option. we need to spread the truth that there are almost always alternatives. Subscribe and hit the notification bell, because I'm not done fighting this system. Next week, I'm exposing the dirty financial tricks nursing homes use to make discharge nearly impossible, including the pending Medicaid trap that keeps families paying private rates for months longer than necessary. I'm also working on a video series called Independence After 75, real stories from people who are thriving at home with creative support systems, proving that aging doesn't have to mean giving up autonomy. Comment below and tell me, what's your biggest fear about aging independently? Have you or your family been pressured into institutional care? How did you handle it? Which prevention strategy from my playbook are you going to implement first? Most importantly, share this video with anyone whose family is having conversations about long-term care. Share it in senior community groups, on neighborhood social media pages, with friends whose parents are aging. Your share could literally save someone's independence. Here's what I want you to do today, not tomorrow, not next week. If you're over 65, start that conversation with your family about your independence criteria. Write down what circumstances would actually justify institutional care versus what's just fear-based thinking. If you have aging parents, ask them directly what they want their life to look like as they age. Don't assume you know. Don't project your anxiety onto their choices. If you're a healthcare worker, start questioning whether the institutional placements you recommend are truly necessary or just convenient. Remember that your professional recommendations have the power to change someone's entire life trajectory. Look, I know this system seems too big to fight. I know families feel helpless when medical professionals are telling them institutional care is necessary and safest. But I'm living proof that you're not helpless. I'm living proof that the system can be challenged. I'm living proof that independence is worth fighting for at any age. 18 months ago, I was told I wasn't safe to live alone, that my family would be irresponsible to support my discharge, that attempting independent living at my age with my conditions was dangerous and unrealistic. And today, I'm healthier, happier, and more engaged with life than I was in professional care. I'm managing my own medications, maintaining my own home, contributing to my community, and making my own choices about my own life. The difference? I refused to accept that institutional care was my only option. I did the research, built the systems, educated my family, and fought for alternatives. You can do the same thing. Your family can do the same thing. But only if you start planning before the crisis hits. Only if you understand your rights and options. Only if you're willing to challenge a system that profits from your dependence. Subscribe to this channel if you want to learn how to age powerfully instead of just aging safely. How to maintain autonomy while addressing real needs. How to stay in control of your own story instead of letting fear write it for you. Because aging isn't about giving up, it's about adapting. And the best place to adapt is usually in your own home, surrounded by the life you've built, supported by services you choose, making decisions you control. That's not just a possibility. For most people, with proper planning and support, it's completely achievable. But you have to fight for it, you have to plan for it, you have to believe you deserve it, because you do. Hit that subscribe button if you're ready to join the fight for aging with dignity and independence. I'll see you in the comments, and I'll see you next week when I expose how nursing homes use financial manipulation to trap families even after patients are medically ready for discharge. Until then, keep planning, keep advocating, and remember, your independence is worth fighting for at any age. Never give up, never give in. And never let anyone convince you that institutional care is inevitable when alternatives exist. Because as I proved, with enough determination and the right strategy, Escape is always possible, even when they tell you it's not.